The digital world is fast growing and it's a key part in all our lives, from online shopping, finding contact details for local businesses and looking after our health. The NHS needs to be at the front and centre of digital advances to help people live healthy lives. In the Black Country, we're committed to starting with people, so we've been asking what opportunities and challenges people face in the digital health world and what barriers they are aware of given their experience.
Our surgery brought in an e-consult system. I was initially, even though I'm fairly digitally adept, I was a bit concerned about how it would work. It's now been in use for some time, perhaps a couple of months. I've used it on 3 occasions and I found it absolutely tremendous. It's worth a treat.
For me, and I think for the visually impaired community, the provision of digital services is a key thing, that you have a message sent from the GP surgery to remind you about appointments. That's great, I can access it.
I don't have to speak to a doctor. It's there straight away, it's immediate, you can look something up. And also, if you've got a problem, you can also type that in and you can understand what the problem is and what you should be doing and how urgent it is. And also the doctors, you've got your email address, so you can use Accuris, I think it is, send an email, and the response is very quick. I like that. Like all over the weekend I kept looking to see if my results were through, and then they came through once I was sitting there, and that for me it's quick.
There may be times, for example, if I just need a prescription, do I need to go into the surgery, make the journey to go and do that, or can I just book that online? If I just want to see a simple result, for example, of a blood test, I might just want to do that online because that's convenient. Do I need to take time off work, or you know, in order to be able to do that?
I used the app because the little one was bad. She got an ear infection, couldn't get through into the doctors, it was over the weekend. I got online, that says now they video call you back and they will see face to face, like, which I think is brilliant.
I work for P3 Charity, it's a homeless charity. And one of the main barriers of getting into, say, health services or GP services is the online application people have to do now. Many people now haven't got a mobile phone. They haven't got a mobile phone when they come to us. And the first thing they need is an email address, and of course, it's near on impossible.
I've been helping for the last 3 to 4 years, 6 different people, elderly people who haven't got the internet and can't use the internet. They haven't got email addresses and cannot access a lot of these services. So people such as myself, and sadly will have to step up and try and help as much as they can until a way is found to let them have better access.
I mean, quite simply, there are people that can't afford, on one hand, can't afford the kit, can't afford the data, or they can't use the kit, don't know how to, even if they can afford. I mean, we all hear about young people, that young people know how to use it. But I work with young people in my day job, and I can tell you most of them don't have the data to be able to use it. So that needs to be something that that is something that needs to be addressed.
Because the digital things don't talk to each other, I've had to keep travelling miles to get tests, which, you know, my GP could have done.
We talk about equality. There is no equality where digital is talked about. I'm not saying digital hasn't got a place, because it has. For those that, you know, can embrace it, good for them. But what about those that can't? They really are being shut out.
Realising that people struggle with language barrier, so a lot of things are translated in English, not many people understand it.
I am non-digital, so I don't use anything. So communication is my problem. I can't access my health records, which I believe other people can. My GP normally writes to me a couple of times a year, annual blood tests annual checkup appointment. They've stopped doing that because I've got a mobile. They text me now. I don't always see my texts, or I lose them. I'm not that good on a phone, and I've asked them to not do that, to write to me, because a letter I will take more notice of.
I know there was a big push in the past to get people to use the internet and get them to use basic programs, but now it's all on the phone, so I'm not sure how the NHS are helping people. Like, I don't know, they could set up a workshop to say, here's the app, have you all got Android phones or Apple phones?
They've got to be aware that there are people who aren't digitally minded, never will be, and they've got to address that situation. There has to be a question asked at the beginning: can you use the internet? And if so, have you got access to it? And then they can then know whether they can contact them via the internet, or if they need written letters.
Our ambition is to coordinate a system-wide digital programme, ensuring our staff members and partner organisations have access to digital facilities to achieve our strategic priorities in a way which addresses digital inequalities, maximises innovation in both the organisation and delivery of care, and provides our workforce with an efficient working environment. Thanks to everyone who supported this so far.
Our digital strategy will showcase this work across 3 areas: digitise, connect and transform. Over the next 3 years, key activities will be achieved as detailed on the strategic roadmap. This includes system alignment, shared care record and digitising adult social care. We know one size doesn't fit all, and that there is an issue around health inequalities when it comes to digital advances, and work is now in train to address this. We've handed out equipment and gifted data to some communities, and recognising that trusted voices are key, we're working in partnership with NHS ambassadors and Healthwave to understand barriers and support the uptake in NHS app registrations. The Black Country has been one of the lowest areas nationally and the lowest area in the Midlands for NHS app uptake. Since February 2023, Healthwave has engaged with 32 community groups, reaching 106,823 individuals, and held 7 masterclasses with 77 live attendees and overall 403 views of the content. This has led to a number of successes, including inclusive uptake of the NHS app, supported through content and community engagement, helping people access and engage with services they need when they need them, supporting local providers to support their communities and overcome health and care challenges. The latest NHS app uptake figures show 48% of GP patients aged 13 and above are now registered with the NHS app. This milestone positions the Black Country as the 2nd fastest growing ICB in the Midlands. The ICS digital strategy will now be launched across our Black Country partners, and we will continue our journey to digitise, connect and transform.